Well, hey, how you doing? Welcome to Hibachi Talk, another exciting 45 minutes of your lunch hour. Gordo, the tech czar. I'm here with my good old buddy, Andrew, the security guy. Nice seeing you, buddy. Nice
to see you, man.
Nice to have you around. We've got a really interesting show today. This is, by the way, this show is live, unedited. So what you see is what you get. We don't chop this thing up. So
don't run them off.
Yeah. If we mess up, you got it. So it's like the old TV days when I was growing up with black and white TV and there was no editing or clipping or any of that kind of stuff.
It was always live.
It was always live. So anyway, we got an interesting show today. We're going to talk about some unique things in the wonderful world of technology and women and healthcare. Our guest today is a lady by the name of Lauri Rasmussen. She's the Vice President of Operations at St. Francis Healthcare System.
Awesome.
So interesting lady who started her career in tech.
We get all kind of interesting ladies on here.
We do better at that.
They're so smart.
They're smart, a hell of a lot smarter. Welcome to Hibachi Talk, and I'm Susie, and Sarah.
Yeah, we're going to be guests,
We're
maybe,
here.
if we're worth talking to.
We're out of here.
That.
Yeah, my voice, I'm sorry, a little raspy today. I was at a panel this morning. We were talking about technology. I thought it was interesting. A lot of people were concerned about security, which I knew you'd appreciate, and a lot of people were also confused about cloud. And so I guess because we're in it so much, we don't realize that people are still trying to figure out what the cloud is. A lot of people understood what the cloud was this week when iTunes took a hit, and they couldn't get to their music libraries, and et cetera, or the store. So they got an introduction to cloud there. So it's been a kind of another event-filled week. I like my new voice. So anyway, so what's happening with you, my man?
Well, I was traveling so much, so this week seemed like back to normal. A lot of work. I had a trade show in town, the facility maintenance management show. Well attended. A lot of folks there concerned also about trying to take apps to the cloud. Those folks don't want to wear another hat, right? They don't want to manage the security of these facilities. They're the resident managers or board members, things like that, and they need the security, but they don't know how to manage it. And so they're concerned also about, if we connect it to the cloud, what's at risk for us. So there were some questions about that. It was interesting, group of attendees, well attended for us. It turned out to be quite an event. I was surprised.
Yeah, I think what I'm finding is interesting. There seems to be more and more people that are interested in finding out about the technology industry. And for me, it's because everybody is touched by tech now. I mean, name one of you sitting here that's not in some way or another, whether it be in your personal lives or at work, you're involved in using technology every day. And so there's more and more awareness. I can remember when we used to do these panels and 10 people would show up. Now we're looking at 50 people showing up and asking incredibly challenging questions because they really are aware of what's going on and are trying to get a better understanding of what's happening.
Business community.
Business community.
Sure, business leaders, right? Or do you think they're looking down at IT and looking at their technology saying, hey, I need to know more about this? Or I mean, is it from the C-suite?
Exactly. Sure. I think they're sitting there going, wait a minute, Target gets hacked and, Home Depot.
Sony gets hacked.
Sony gets hacked, and I'm little small business here, One of the guys said this morning, he said, well, I'm a small business. They're not coming after me. I know they're not coming after me. And I went,
something to say to him.
Yeah, wait. Let's go in and we'll check and we'll see that they're not coming after you.
Wow.
So there's more of that awareness. I think we saw a lot of gasps when we talked about passwords, and how there's supposed to be like 20 characters, and with the advent of two-factor authentication and things like this. The other thing I found was interesting. There was a lot more women in the audience than we see. So, and that's one of the things I wanted to talk to you about today is like, you mentioned it last show, you went to your event. What was the percentage of women that were at that event?
Around 25 at all three different events. I remember they all took a poll and they all had them all stand up as well. And you could look around the room, it was clearly a quarter to a third.
To a third are the women, are in the, we'll call it the tech industry.
Yeah, and it used to just be a bunch of bald guys with goatees like me. I mean, the whole room looked like bowling balls, It was ridiculous.
Ponytails. Did you ever have a ponytail?
No.
No, me neither.
Sorry.
I only wish.
The one down here, maybe you could grow, but
anyone that had a ponytail automatically got paid $100,000 a year the moment they walked into the job. Remember the we always go all over the place. Remember the .com before the .bomb boom?
Okay.
They used to say that a full-time employee was someone that brought their lunch.
Okay.
Because they were bouncing from one job to the next.
Wow.
They weren't getting help. And it was interesting, but it was a male-dominated industry, and it still is a male-dominated industry. And I keep asking myself, why? So do you have any what are your perceptions of it?
Well, I think because it was male dominated, we're still in the way, right? So as women have entered that workforce, they're obviously getting educated. They're obviously smart enough. There's no question there. What's going on now is we're grasping at their jobs. So can we keep them before they run over? It's just with the youth, the millennials, everyone that's coming behind us. I think people work a little longer. You know, having that experience in the workforce, especially with big systems, you know where all the cobwebs are, and so people that have been around a system for a while or an industry for a while bring that kind of value, and we're not getting out of the way quick enough. You know,
for them,
and
right?
when we do, you know, I think they'll come up it'll be balanced. You know.
Right. Well, it's interesting. According to some research, 2/3 or 63% of teens, females do not consider tech as a career.
Oh, really? Is it like from high school or
at
college age?
high school,
Wow.
and it was with Girl Scouts and with high school. So that number's pretty darn high. You know,
It is.
You know, that 63% still don't think of science, technology, you know, math as being an industry that they should get into.
Wow.
And
Is that just old parochialism in the schools still pushing that down, or that makes no sense? Were they taking home ec?
yeah, I took home ec. Careful.
Wow.
You
may need it, my friend.
I also took carpentry class. You notice I don't have this finger. But yeah, we had a choice: home ec or carpentry.
Carpentry.
Carpentry. So, you ever notice your carpentry teachers always had a finger missing?
Oh, there's always something.
That's
From that table saw they
were
slipped
gone.
on.
Man, we just go everywhere. So anyway, so coming back to the 63% of that number of women that have not picked tech as a career is because they were never told the opportunity. And what the research, which I thought was really interesting, when the girls or young ladies were told of what they could do to improve society and also economically improve themselves by getting into tech, more of the women started getting into tech.
I see.
So I think that's that nurturing thing that's in females, right? I can make the world better by getting into tech. Yes, you can.
Sure.
And here's how. And look at the industry, whether it be the greening of the industry, the food industry, or any aspects of anything that goes into the technology fields, you have that opportunity. So that's what started to bring some of them in.
I see. And I noticed that, I think, was it IBM? They did a great, you know, they talk about what these people are doing, and I'm an IBMer, and we're changing the world. And I mean, those are really tend to be men or women. You really don't know. Their stories are so good, right?
Right.
So, I mean, I think there's should be openness. The doors are open. The guys that have been holding those positions, we're holding positions from young guys, too. I mean, you know, we're moving up and out of the way. And
Right.
as the technology advances, I really think that we'll find a lot that equality will be there. You know, I think there's a lot of women driving technology firms now out there in the world, large ones, small ones. You know,
Right. If you look at
I work for a woman, so
well, don't we all, in one way or another? So definitely. So it's interesting. There's a lot of senior execs that are female now in large tech companies: IBM, Cisco, Facebook, Twitter. I'm just going down the list. Either at the top or near the top and they're not the CFO. They're actually head technologists within those organizations that are female. Another interesting number, though, is kind of one that I thought was in college right now, in university, studying tech, and let the audience out there just try to figure out how many you think are female in the schools. Less than 20%.
I was going to say, yeah, my wife has an MSIS, and when she went to school, she was quite often the only woman in the class.
Yeah, and so.
And this only but it's been a while back, 6, 8 years ago.
Yeah, so don't say too many long, because then you'll date her, and when she comes on the show, she won't talk. So, but so you're looking at 18% that are in university that are in the MSISs or IT-related courses or engineering-related courses. That's small. You get into the work environment, and guess what? Your number was pretty close when you were at those events. It's 25% are in tech. So 75% are still male-dominated. Senior executives in tech, 11% are women. Now that's higher than I thought. There's 11% of the senior executives in tech are female. So that's a big change that I've seen happen over the years.
So it used to be the single digits, and now we're pushing into the 20s, trying to follow that 25% on up.
Right. And so I think, and the other thing that I found, and this is something that I think all of you should be sitting out there, especially if you're in the tech business, is that the females more than males, because males got these big damn egos, like mentorships, and they'd like to be mentored. And
Yes.
so, and they're open themselves up to that more than the male, right? The males tend to be, well, I know it all, I'm a male.
Sure.
But the females can come in and they have a better mindset, and they like to hear where they can go and where the opportunities are presenting to them. And like I've said to you before, my number one engineer is a female at PAXA.
Do you think they're less risky? I mean, do you think it's maybe some of this is in technology is because it's been led by men who were more risk takers and they've started these companies and they sit on top of them, versus women who are maybe a little less risky in the entrepreneurial side, right? And so they tend to want to learn what they're doing first instead of putting them. Guys will just go on out and fail and fail.
Well, there's a lot
of still tell you they're great.
There's a lot of startups that are headed up by women that I've been reading about. You know what I'm finding interesting? Here's two old futs sitting here talking about getting young women into this industry, or we're asking these questions, but where's the woman that we're supposed to be asking these questions?
She's coming on shortly.
We'll get Lauri up here, and maybe she can tell us, why it's the way it is. So anyways, it's a fascinating kind of situation or circumstance that we have in front of us now. The panel I was on this morning, after the panel, people come up and talk to you. I think it was like 5 or 6. There was 2 guys, and then the rest were females who were in some aspect of the tech industry. Sure. They too were talking about things that they were doing and how they were trying to expand their careers into that side. So, a really fascinating piece of conversation, and that's one of the things we've been trying to figure out. What's the audience for this show? The people are saying, like, okay, who's your audience? Who's your demographic? And the more and more I start thinking about this, the more I'm going to start looking at how we can push the females to watch the show, maybe nudge us to change the content so that they can realize all the different aspects of the tech industry that they can certainly have huge opportunities to get into. And it doesn't have to be math, and that's the other thing, is don't get all hung up that it has, well, if I'm not good at math, I can't get into the tech industry.
Not at all.
No, there's just so many different verticals within the tech industry itself.
Sure.
I mean, and Melanie, PAXA's marketing person, obviously a female, but in a large tech company who has to promote and sell technology. Sure. So she's in that vertical space, but and maybe she's a math major. I don't know. I've never asked her that, but she certainly knows how to manage the financials. Every time I try to spend the marketing money, she lets me know.
Good.
Wait, no. I got that earmarked over here. So I mean, there's all of these different things. So I'm thinking for those of you out there that are sitting here at the beach, think about what it is within the tech industry that really excites you. Maybe it's the social media side. We had Tara Kumans on, again, social media, the web side with Mary, so her side. I mean, and then we talked to Lauri. We'll talk about what it's led for her in her career. So really kind of a neat thing. Changing gears a little bit. What you got? Anything on the security side that you want to scare us with today, like you normally do?
I have a disappointment I want to talk about today.
Okay.
So maybe we've got a graphic here. I want you to see that big F. This is a standard little scan done by Qualys. Anybody can log on, and when you have this was a scan of my healthcare logon, my portal, and what this F indicates, reasons why they score an F.
Is how healthy you are?
This is their security on this portal. So these guys are not upgrading. They've not updated their certificates on this site. They've not handled the negotiation of those certificates. So when you're going into your healthcare portal, you're really relying on that provider to have protected you and your information. Right. And this site is in need of maintenance. It fails the freak test immediately, and that's why they had the F. Now I ran this I think on a Wednesday, because a big article came out about how many of these portals are really lacking in their handling of their certificates. Right. Now I just scanned it again just now. They've got a B, so they've already done some maintenance this week. So they surely didn't find out from me about this. So it's not that they don't know, but there was a vulnerability there, and I don't know how long it was there. And if you are out there and you have these logins where you have sensitive information or you're doing things, take that URL and go to Qualys, their SSL tester, and run that, and just find out how secure this organization that you're visiting is. And if you're concerned, if they come back with an F, let them know. Sometimes they just haven't done the maintenance and they just don't know. And that's something you can kind of do to help protect yourself and help the organizations that you're visiting or using their resources protect you.
So that website again, so John Q. Public can go download an app or just go
No,
to a
it's a
portal?
website, Qualis.
And they can just go to, we'll put it up on the,
Yeah, you can
on
Google
Twitter feed.
SSL Labs. SSL Labs will come up for if you just Google that, and you'll find the test there, and then you just go to your portal and copy that URL from the login and then just run the test on it.
And run the test on it. So you can do it for any portal, so I could even go to
Sure.
Amazon or all of them and just see.
Yeah.
So if you, wow.
I run it again. The big boys are good. I'm saying these large enterprises, Amazon, those guys are good. And there's something I should say, I should caution you that behind that portal login page, there's obviously, or hopefully, there's a lot of other technology there. So this isn't their entire security posture. You fail this one test, oh my gosh, it's an open hole. But it's definitely an open door into the next layer. And your large enterprises have sandboxes and many things in there in the way.
Right.
So this in itself is not a definitive gauge, but it's a sign of a lack of maintenance of the server and the certificates. And there's a little work and a little cost there that they've got to do to keep this stuff maintained.
Keep it maintained. So, but like you said, so it's like this is one aspect of their entire security portfolio. So there's a lot more that's in the backside of all of those, and that's very true.
And if you have logins on your little web server for people you're inviting in, you definitely want to be doing this types of scans on those.
On those as well.
Make sure that you're
Pretty
staying
cool,
up to speed.
Pretty cool. Well, guess what? I drank my beverage, and it's time for me to take a Lua break.
Right on.
So we're going to do that, and we'll bring Angus. Hey, get him off the beach down there and bring him back.
I'll get him.
And get Angus and see what his silliness is up to today.
Right on.
All
See you in
right.
a minute.
See you in a minute. Thank you.
Here's the deal. I'm Jay Fidel. I'm the host of Hawaii, the State of Clean Energy, which is the Energy Policy Forum's program on Wednesday. That's how we call Wednesday Energy Wednesday. We call it Energy Wednesday every Wednesday. Are you surprised? Okay, and we try to get guys like Jim Alberts here from Hawaiian Electric who can tell us what's really going on in energy. We want to be informed. It's so important. It's the most important initiative in our state. Clean energy is major, okay? And that's why we cover it on this show. That's the deal. What do you think, Sharon?
I think that's great. That's why we're here every Wednesday from 4 to 5, and we hope you all join us so we can hear people like Jim coming on our show and co-host Ray Starley from Hawaii Energy.
Okay, Jim, you've been here today. You've seen this. You heard what she said. What do you think?
I think it's a tremendous opportunity for people to come together and talk about the issues. Oftentimes, there isn't a good forum to bring these key issues out into the public, and this is a tremendous way to go about it. And the activity of this show is essential to keep talking about energy because, as you said, it's such an essential part of our lives that we need to pay attention to it and we need to think about the future.
Okay, Ray, your turn.
Well, this is a special time in the history of Hawaii where we're making some pretty radical changes in the way we use energy and generate energy. And this show is the one place you can count on coming to every Wednesday and hearing something about the latest issues that are on the table, being discussed, that will affect us all going forward. So come join us, and if you have some ideas you want to share with us about energy, give us a call and let us know. We'll put you up here and let you talk for an hour. So come see us.
Thanks, Ray. Thanks, Sharon. Thanks, Jim. It's great to be, from ThinkTech's point of view, it's great to have this show. We love the show. It's our most important show. So come around and listen to us 4 to 5 on Wednesday. Thanks a lot. Bye.
Aloha.
Aloha.
Aloha, my name is Paul Jackson, better known as PJ, and my local interest is in sports. I have my own sports radio show at KWAI AM 1080 that you can stream live. I also have my own website, pjsportsradio.com. We have live guests in studio, and we talk about discussions and topics that everyone wants to know locally here on the islands. We cover everything from surfing to basketball to whatever's going on locally, sports-wise. We try to do our best and cover the topics in depth as much as we can. Once again, thank you for joining PJ here on Hawaii Sports Update. Mahalo.
Hi, my name is Seymour Kazimirski. I have a show called Seymour's World on ThinkTech Hawaii. Our show is about opening minds and facilitating conversations. To tell you the truth, I have no idea what we're going to be talking about. I have no idea who our guests are going to be, but I guarantee you we're going to have lots and lots of fun. Aloha from Seymour's World.
Andrew. Drew, wake
Oh,
up,
we're
Drew.
back. Sorry.
Drew, wake up.
Sorry.
You didn't pay attention that
Angus
much.
is in the house with
You
us.
didn't.
Sorry, Angus.
Hey, wake up, Drew.
Sorry,
You're
brother.
You're sleeping.
Sorry, man. Sorry about that. I was still digging into my certificates over here.
So how you doing? How you doing there, Drew?
Very well, sir. How are you today?
You know,
I see you're kilted up again. What's going on,
you
man?
You know what's happening next week? We got St. Patty's Day next week, so I'm getting myself all ready.
Ready
We're gonna
already?
put a few green beers.
You
You're
got
gonna
your
join me.
cup. That's right, I will.
It's going to be awesome, man. Another fine time to have a 3 drum or 2 or 3 or 4 or 5 or 6. Anyways, that's awesome. Anyway, nice seeing you, Drew, and nice of you to be awake for a change. Anyway, and thanks a lot. I got my drink. I got me drinking now, so it's awesome. Just it's terrific. Anyway, we know what we're going to talk about today.
What?
Not iTunes, but we're going to talk about Apple. They got a new watch coming out.
Oh,
And
the
I'm getting
iWatch.
ready for it. There it is. That is that watch. It's the Apple Watch. And it's really, really looks like it's going to be cool. It's going to come out and available to buy online on April the 10th, and then you can get it for sure on April the 24th. But what's real cool about this watch is it comes in 3 different types. There's a cheap one.
I need that one.
A cheap one.
I'm going for the cheap one.
The Scottish version. You got that
Scottish
one.
version.
You know, they call it the watch. The sport watch is the number 2 is the sport watch, and then number 3 is the watch edition, and that sucker gets up there close to $10,000.
Come on.
Yeah. Ooh, my goodness.
10,000.
Obviously, they're not going to see too many Scots buying that one. That's for sure.
They're paying you too much to host this show, man.
Oh, you got to bet. So I'm hoping the Apple guys will give me a call and give me a freebie so that I can get rid of my other Microsoft band. Nice try. Anyway, so, but it's going to be cool. The battery's going to last for 18 hours. You've got Wi-Fi and Bluetooth on it, and it's water resistant. You got your heart rate sensors. It's got a accelerometer on it and gyroscope on it. It's really got a lot of cool
It's
stuff.
a watch. It's a watch that only runs for 18 hours.
Yeah,
Is that what you said?
That's right. So you got to sleep for 6. That's it. That's all you
Oh, I
get.
see.
Yeah,
Okay.
yeah, you
Don't
put it
need it
down
while
when you
you're
sleep.
asleep.
Yeah. So anyway, the first one that starts about $350 for the little one goes up to almost $600. Then the other one goes up over $1,000, and then the other one, like I said, gets up to 10,000 smackaroonies. So lots of money there. But anyways, we're looking forward to it coming out. But here's the coolest thing: you want one now? Go to China. They've already mass-produced a bunch of them on China. You can get now cheaper. You don't have to spend the money. So there's a whole bunch of people from Scotland flying to China right now to buy all these. Anyway, that's what we've got right now. So anyway, take it away, Drew, and we'll see you next week. How you doing?
Nice job, Angus. This guy is on the ball with his toys. I don't know if I'm going to get an Apple Watch. I don't know if you're going to get an Apple Watch, but if you get one, text us at Hibachi Talk, tweet to us, and let us know what you think of your Apple Watch, and we'll, kind of give Angus some feedback so that he doesn't go out and spend $10,000 on something he doesn't need. So, Gordo's back. Lauri's here.
So
And
why don't I introduce this young lady? Well, hi, Lauri. How are you?
I'm fine. How are
Yes.
you?
Nice to see you. That's
And how do y'all know each other?
We'll get into that a little bit later. So, and it's spelled L-A-U-R-I.
Yes.
So this is Lauri Rasmussen, and she's the Vice President of Operations at St. Francis Healthcare System of
Yes.
Hawaii. Not the S, right?
Yes.
So we'll talk about some of the things that you're doing over there. But like we always ask all of our guests, so where did you go to school?
I went to Star of the Sea High School, and I'm not going to tell you what I graduated.
Star of the Sea. Star of the Sea still around?
Yes, elementary school.
Oh, elementary school.
Yes.
But
Yeah.
where did you go for elementary school?
I went to St. Patrick's.
I know. So a very good Catholic girl we have sitting here, obviously.
Yes.
So
yes,
wow.
yes.
So you went to Star of the Sea.
Star of the Sea.
Is it
and
Ina
then-
Hina?
Yeah.
Yeah.
Okay.
Yeah.
Yeah,
Elementary
kind
is
of
Ina
on the
Hina.
on the Ina side. And
Yeah.
so now you have an interesting story because you started in tech at a very early age.
I did.
Yeah. How old were you when you started in tech?
I was a volunteer actually at Queens when I was 14.
14 years old.
Yep.
So what were you doing in tech at 14?
I was a data entry operator, which
Wow.
was quite fun.
Punch cards.
Punch cards.
Yay,
you
we
name
know that
it.
world.
Yep.
Congratulations.
So
Thank
so here
you.
you are, a few years later, and you've got this corporate exec, and you worked your way through tech. But you did more than just, you stayed a long time in tech.
I did.
Yeah.
Different aspects of tech, not necessarily, just heads down data entry kind
Yeah,
of stuff.
so what were some of the cool things you did?
I actually went forward and got real interested in the old AS400. So I was a query geek. For
Okay.
a long time, I was a query geek. And then after that, got into the more medical record side of it, so the Windows side, doing electronic medical record and then quality testing for electronic medical records. Then got past that and then went into coding. So I started coding and abstracting medical records. And then went into quality for building a dashboard, which is a GUI over your AS400s and all your separate applications
Right.
to create one dashboard for multi-systems.
Wow.
So, and then,
That's real technology.
this is
deep
again, I love it.
technology,
We're talking,
actually,
we're talking
especially
about
the
women
AS400.
in tech and like all the, from the aspects of what you did, what you've done. Were you selling physician billing systems or something too at some point? You were doing something along those lines.
Yeah, there was, had to do with pharmacy, a lot of
Okay.
pharmacy interfaces, those kind of
Those
things.
kinds of things. You were out there doing that. So you're
Yep.
into tech sales. So let
Yeah.
me ask you this question that we were pondering. So why is there not as many women in tech as there should be?
Or are there? Do you run into it?
You ran into, and you were, we're not going to date you or anything, but you were one of the very few
Pioneering.
females that came in early.
Right,
Especially
right.
coding, were you doing COBOL?
No,
With the
no,
cards? So
SQL.
that was data entry and then SQL, okay. Gotcha.
Yeah, I don't see it like that.
Okay, good. I like
I-
it.
Awesome, that's what we
see-
need, a better perspective.
Yeah, I see a lot of women in tech, so I'm kind of interested to see what why
you
you think there isn't.
Well-
Would you say it's 1 in 4? Like, 25 or,
I look around my
one,
office.
3 to 1 men to women? Or would you say it's, in your experience, you think
I
it's
think
a
it's
little higher?
pretty 50-50. I think it's
Yeah,
pretty
right on.
pretty close.
Is it because of, now let me throw this out, 50-50, but it's healthcare. Do you think it's because there's more women in healthcare than there is in?
That is a good possibility, yes.
Because you certainly
Yes.
see that, nursing
Yeah.
for sure is a female-dominated industry. There's a
Right.
few males in there, but so there's that. But healthcare has certainly been one that draws.
Is the healthcare field, is it 50-50? Is it dominated by, I don't know. Does anybody know?
I
You know
think
offhand?
I
Is
think
it
it's 50-50
pretty
in
balanced?
healthcare.
And
Yeah,
if you say
definitely.
healthcare, you got doctors, nurses, all kinds of different types of physicians today, specialists, operators of equipment.
Right, right. So yeah, that's probably what.
Probably,
it is.
the pharmacists, well, that's a 50-50 too,
Sure.
if I look at it.
So when you go to, especially you go over to telecom, datacom, probably that's heavier. They were lineman guys, and stuff that helped build those industries. So maybe those were more heavily weighted to the male
To
side.
the male side.
Early on.
What about the nurturing point I made earlier on about maybe that the women started to realize there's more opportunity in tech because of that, realizing they can do more in helping society? Do you think that could be why healthcare's got more women in it than?
Possibly, but I think a lot's changed over the years as far as the influences in schools. I think nothing is on paper anymore. Math isn't even done on paper anymore. You turn your homework in online by midnight. I mean, I think the influences in school are going to change the way this has been in the past.
Right, well, you've got 3 boys.
Right, I have 3 boys. Yep.
So, you're in a male-dominated house.
I am, and one is actually a comm major, so,
So
how that ties to tech is a whole nother avenue.
it's a whole nother avenue. So I'm just thinking about how wonderful it must be around your house. Who's in charge?
Me, of course.
Oh, okay. just checking.
Yeah, what answer were you expecting?
Oh, my loving husband, of course.
Well, yeah,
When you let him.
yeah,
He gets to weigh in.
yes.
All the guys we get like 10%,
Yeah.
right, in the household.
Her 6-foot-plus
Yeah.
tall husband.
Yeah.
When she lets him.
There you go.
Plus, all your boys are 6 foot and
Yep.
change. So.
Yep,
man,
they are. They keep me busy.
They keep you busy. So let's talk a little bit about, now you're doing some really cool stuff over at St. Francis now.
Yes, we are, we
So
are.
let's talk about that. Educate people what's happened since, everybody still thinks you're out sometimes at St. Francis West, but that's all changed. So what's going on on that side?
So I guess back in 2012, we had a large transition of the 2 facilities back to St. Francis.
Ah,
So
St.
that's
Francis.
the one
That's
west.
the west location and the Liliha location.
Okay.
And so since 2013, we've done a number of things as far as construction is concerned. We've also sold the west property, and that is now Queens West. So that's pretty much done over there, but we do have a facility there. It's a hospice facility that's under renovation, or
Oh, I
soon to
see.
be under renovation. The Liliha campus, though, is thriving right now. We've got almost done construction for a 119-bed skilled nursing facility. So that is slated for grand opening on April 24th.
April 24th. So, okay, hold that thought. It's time to pay a bill. So
Okay.
we're gonna take a quick commercial break, and we'll come back and delve a little bit more into what's going on at the skilled nursing facility.
Okay.
Thank you very much.
Hi, I'm your host on ThinkTech Asia, Bill Sharp. I look forward to you joining us each Monday between 4 and 5 o'clock when we film right here in our studio in downtown Honolulu. The show, ThinkTech Asia, focuses on contemporary events in Asia. And by Asia, we mean anything from Hawaii, south to Australia and New Zealand, west to Pakistan, and as far north as the Russian Far East. Clearly, this is one of the most economically dynamic centers of the world, and we bring you up to date on what's going on in a whole host of countries in this very vital region. We look forward to seeing you. Aloha.
Well, how you doing? Welcome back to Hibachi Talk. We're here with Andrew, the security guy, and our lovely guest, Lauri Rasmussen, from St. Francis Healthcare System. And you were just talking about what's going on. So Liliha is building a
119-bed skilled nursing facility.
skilled nursing. What's a skilled nursing facility?
Skilled nursing is the post-acute, so when you're in the Queenses and you're Hawaii Pacific Health, and you need a lower level of care, not so much the acute intense, they drop your level of care to skilled nursing,
Right.
where you can do your rehab, post-stroke, those kind of things. So it's lower level of care.
So, wow. So now you got 119 beds, and you're opening up on when?
Grand opening is April 24th. I'm not quite sure the date for the first patient yet, but we will be opening the floors on April 24th.
Do you need licensing for
Yes,
this? Oh.
yes. The operator needs to go through licensing and certification. They also have to move in all of their equipment, all of their IT for their electronic medical record. So yeah, we got a ways to go before we actually get the first patient in the door.
But there is a lot of IT, and that's another thing to be noticed. You're the vice president of operations at St. Francis Healthcare, but IT reports to you.
Correct.
So again, woman, senior exec, female,
Making decisions.
Making decisions.
And money decisions as well. I'm guessing you're
Yeah.
budgeting technology.
So,
Good.
what are some of the kind of cool technologies you're putting in over at St. Francis related to skilled nursing facility?
Well, we have a whole brand new infrastructure set up by PAXA. Thank you very much.
You're welcome. I love the plug.
Yeah. Yeah, so it's been, we started with, bricks and mortar. So they've gone through and done the whole build-up of all behind the walls and gotten all of that set up from a wireless infrastructure, telephone system, nurse call system, everything is all brand spanking new coming through. So yeah,
It's gonna be
really exciting.
One of the more advanced facilities in here.
Yes.
Definitely one of the newest.
Yes, it will be.
Wow, that's hot. Now, is your website up yet with the photos, with any photos of what it looks like and all those kinds of things?
Yes, it is. We actually just released the new website this week. If you click on the transformation link, you'll be able to see all the new stuff.
So you go to the St. Francis Healthcare System.
No, www.stfrancishawaii.org.
And then you can see what's happening in that. And I do have to say, if you look at it looks like a hotel. It doesn't look anything like a hospital or even a skilled nursing facility for that matter. It looks it's really nice
The
quality.
facilities up there were due for renovation.
Oh,
So,
yeah. Absolutely.
Yeah, so it's good that somebody, got in there and took the opportunity to bring, that level of care to that area.
Now, who had the vision for this?
Jerry Correa, our CEO, has been instrumental and so supportive of all of the change that we've gone through. It's been a long road, so to get to this point, sharing the vision with, of course, the Sisters of St. Francis, our board of directors. There's so many people involved, so it's just here, finally.
Funding it and the financing behind it. Are you allowed to say how much money you're spending on this, or is it close secret?
I'd rather not.
Oh, okay, it's a lot.
Yeah, it's a lot.
Well, you can tell, and you can certainly tell that it's a quality operation that you've got going on up there.
Yeah,
Now,
it is.
So can I ask how long will the testing take? Or you've been going through that already? Like you said before, you can actually get the first patient. You have some certs and stuff you mentioned. Is that a period of time, like a 90-day period of performance you have to go through? Or?
Yeah, we can, for Medicare certification and licensure, you have to take in your first 10% of what you can occupy in the
I see.
building. You go through that certification process, Department of Health and CMS, all of that,
Wow.
and then you can get your licensing.
And so does it? So
Could
you're anxious
take-
to get that 10%
Yes.
in and really get the wheels
Yes.
turning.
Get the wheels turning. So a lot of support, from our district reps and everything to get this thing moving. And of course, Queens and HPH and all the facilities, they want this open.
So with the technology, one of these guys. You got to test it, right? You need to know. So how have your system tests gone? Have you started all that, or do you need to have like a dummy patient? You bring them through and make sure things work, or how does it? What do you do?
We actually, we're training from the staff up. So this morning they actually had their nurse call training, they had their telephone system training, their security system training. So all of that
Nice.
was going on this morning before I left.
Wow,
So-
that's a lot
Yep.
to absorb, right?
yeah, so you're ramping up and hiring too? You've been out there recruiting as well?
Yes.
So, and again, another great opportunity for all kinds of unique career opportunities within what's happening at St. Francis. So it's like you're being
And what are the
resurrected.
needs? Yeah, what are the needs? What are you hiring for? Like, what kind of positions?
We actually, our operator for the skilled nursing facility is Ohana Pacific Management Company.
Oh, I see.
So they are doing the
They
hiring.
do the hiring. I see. Okay, gotcha.
So, and they'll hire nurses and
Nurses,
clinicians,
clinicians, clerical
support,
support.
IT people. I mean,
Wow.
Yeah.
wow. So very, 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 very neat and very well,
How
very
many
needed.
How many people does it take to run a 120 beds facility?
Oh my goodness.
500?
At-
1,000?
I would say at least 150. I think they're bringing on board. They're going to
Wow.
ramp up to that amount.
And plus all the folks like yourself that are already there.
Yeah.
Wow.
Administration.
The administration. Wow.
Now, you've taken a unique model when you said Ohana Care is the operator of this. So here's St. Francis Healthcare System. So it's healthcare system. So, this model you've taken is kind of unique. Tell a little bit about your thoughts on that, or explain what you guys are doing.
When things changed over the last few years, St. Francis really had to step back and look at what our core line of business is. And of course, hospice care. That's our primary patient care model right now. So then we thought, well, we should look into more partnerships. We want to help, making communities more healthy, taking care of the senior population, taking care of the caregivers who are now taking care of the seniors. One of the stories that I heard was, picture yourself driving up Liliha Street and you've got 3 generations in a car. So you've got the grandchild, the child, and the grandparent. And you're taking them to their new home, their new skilled nursing facility, which they can stay, long term
Right.
at times. So you've got the excited grandchild, you've got the stressed out, anxiety-filled caregiver, the child, and then you've got the senior who's,
Needs care.
needs care, and they're worried because they've got their child who's trying to take care of them. So you get to this place and you want to make sure you have something that takes care of everybody's needs. So the grandchild can go and play in the courtyard. The child of the elder can go to the gym, can get some spa time, can get some relaxation while they're there, and the elder can be there and know that everybody's okay.
And so that's, I see, I never
Wow.
think of it that way. I only thought of the patient. I don't like calling them patient, but I always thought of that client. But that's not the client. Your
No.
client is the whole family.
The whole family,
Yes.
sure. That's
Yes.
a good perspective. I love
And
it.
wow, so that is something that, again, the reason why you watch this show is you get to learn really cool stuff like this.
Yeah.
So that has got me really thinking about some other things. So you're like a landlord then.
No, it's all about partnerships.
It really
It's
is.
really about partnerships. Ohana Pacific had the same vision as we did. We want to take care of a certain population. We also have Hawaii Pacific Neuroscience, who recently opened on our campus, and their focus is on dementia and Alzheimer's, which is one of the biggest diagnoses in seniors. We also have Hawaii Diagnostic Radiology on the campus. They're putting in a secondary MRI, which they've been on our campus for a little over a year now. see about 100 patients a day, so
Wow.
constant churning.
Wow.
So positioning partners that are focused on the same vision.
On the same vision. So, it's not the old St. Francis.
No, not at all.
Doesn't sound like it.
Not at all.
It's a totally resurrected new St. Francis.
It is.
And so what other things do you have coming down the pipeline? What can we expect over the next number of years to see from St. Francis Healthcare System?
We are looking at a senior center, also possibly moving into the assisted living population. You know, there are some seniors out there who can still take care of themselves, but it's nice to have a place to go where you can get some groceries, your meals are all cooked for you, and you just need a little bit of care from some
A little
clinical
check
people.
up once in a while.
Yeah,
What do you
yeah.
think about telemedicine for some of that kind of stuff? Do you think there's value there for folks who can send in some diagnostic, like Gordon wears his band, he's got healthcare data there about himself. Can we broadcast that? You think that's going to continue to grow?
Oh,
in that
absolutely.
senior population as well?
Absolutely, absolutely,
Wow.
I do.
Wow, this is very cool, and you're not going to believe this. We burned through another lunch hour.
Just like that.
45 minutes. We've just touched on the surface of what's going on there. We need to get Jerry on the show
Yep.
and have him take it to the next level. Really,
Sure.
that's really very interesting to see where St. Francis is headed. We're going to keep an eye on him for obvious reasons, but we'll watch it. Lauri, I want to thank you so much for coming in.
Thank
Yeah,
you.
great,
Thank
great
you for
stuff.
having
Thank
me.
Very, very nice for having you here. Andrew, it's always fun to have you here.
It's always a
Take care
good
of
week
it.
as long as there's some hibachi talk.
You got it. And please, follow us on YouTube. And we're now hearing that we might be seen on Olelo or OC16. So
We are,
check
tonight
that
at 9.
Tonight at 9. So, you know, if you need some help going to sleep, I got an idea for you. So watch that. I want to thank Melanie and Emily and Zuri again, once again.
And Jay.
And Jay for allowing us to do this. Enjoyed it. Thank you for joining us. And we'll see you again. How you doing?
Aloha.
Aloha.